Famotidine is an H2 blocker that helps to reduce the amount of acid in your stomach. It is commonly used to prevent and treat heartburn and other symptoms caused by excessive stomach acid, such as acid indigestion. It's important to always check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. This is crucial to ensure you are taking the right product and to avoid any potential harm. As for the daily dosage, it's best to follow your doctor's instructions, and the optimal timing to take this medication is usually before meals or at bedtime. If you're experiencing heartburn or acid indigestion, you can take 1 tablet or capsule of famotidine with a glass of water as needed. Make sure to swallow the tablets and capsules whole without chewing, unless you're using the chewable tablets. In that case, chew completely and swallow 1 tablet as needed. It's okay to take famotidine with or without food. To prevent heartburn and acid indigestion, take famotidine 15 to 60 minutes before eating food or drinking beverages that can cause indigestion. Remember not to take more than 2 tablets in 24 hours unless directed by your doctor, and always follow the directions on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist. If your symptoms continue or don't improve after taking famotidine for 14 days, make sure to stop taking it and call your doctor promptly. And don't take this medication for more than 14 days in a row without talking with your doctor. If you experience headaches, constipation, or diarrhea while taking famotidine, be sure to inform your doctor or pharmacist right away. However, many people using this medication do not experience serious side effects. Be sure to notify your doctor if you experience any of the following serious side effects: easy bruising or bleeding, signs of infection, changes in mental or mood, such as restlessness, confusion, or depression. Seek medical help immediately if you experience very serious side effects such as fast, slow, or irregular heartbeat, severe dizziness, fainting, or seizures. While allergic reactions to this drug are rare, seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. For medical advice about side effects in the US, you can call your doctor or report the side effects to the FDA. In Canada, you can also call your doctor or report the side effects to Health Canada. Before taking famotidine, make sure to let your doctor or pharmacist know if you have any allergies to famotidine or other H2 blockers, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. If you have kidney problems, liver problems, or other stomach problems, it's important to consult your doctor or pharmacist before using this medication. It's important to seek medical help right away if you experience symptoms such as heartburn with lightheadedness, sweating, or dizziness, as these may be signs of a more serious condition. Additionally, if you experience chest, jaw, arm, or shoulder pain, especially with shortness of breath or unusual sweating, or unexplained weight loss, it's important to get medical help right away. Before using this medication, it's important to seek medical help right away if you experience trouble or pain swallowing food, bloody vomit, vomit that looks like coffee grounds, bloody or black stools, heartburn for over 3 months, frequent chest pain, frequent wheezing especially with heartburn, nausea, vomiting, or stomach pain. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor before using it. This drug can pass into breast milk, so it's important to consult your doctor before breastfeeding if you are taking famotidine. It's also important to note that this medication should not be used in children younger than 12 unless directed by a doctor, and older adults may be more sensitive to the side effects of this drug. When taking famotidine, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Some products, such as fezolinetant, may interact with famotidine, so it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. It's worth noting that some products require stomach acid in order for the body to properly absorb them. Since famotidine decreases stomach acid, it may impact how well these products work. Some of these affected products include atazanavir, dasatinib, certain azole antifungals, levoketoconazole, pazopanib, sparsentan, and others. Additionally, it's important to avoid taking famotidine with other products that contain famotidine or other H2 blockers, such as cimetidine, nizatidine, or ranitidine. As always, it's essential to consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency medical assistance right away. In the U.S., you can contact your local poison control center at 1-800-222-1222, while in Canada, you can reach out to a provincial poison control center for assistance. If you're taking famotidine for heartburn or acid reflux, making some lifestyle changes can help improve its effectiveness. This can include reducing stress, quitting smoking, cutting back on alcohol, and adjusting your diet to avoid caffeine and certain spices. It's always a good idea to talk to your doctor or pharmacist about any lifestyle changes that could benefit you. Famotidine is a medication that is used to treat ulcers in the stomach and intestines, gastroesophageal reflux disease, GERD, and conditions where the stomach produces too much acid. It is also used to prevent heartburn and acid indigestion caused by certain foods and beverages. Famotidine works by decreasing the amount of acid the stomach produces. It is usually taken once or twice a day, with or without food. The dosage and length of treatment depend on the medical condition being treated and the response to the medication. It's best to take famotidine at the same times every day to help you remember. It is important to take this medication as directed by your doctor and to not take more or less of it or take it more often than prescribed. Make sure to store famotidine at room temperature, away from light and moisture. Avoid keeping it in the bathroom, and always store it out of reach of children and pets. When you no longer need it or when it's expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.